Hello, I'm Cameron Abbasi, Editor-in-Chief of the BMJ, and we're delighted to be supporting the first international conference on race and health in medicine and healthcare, which has been wonderfully put together by the Health Observatory and our colleagues in the Commonwealth Fund. I'm sorry I can't be there today. As it happens, these are the exact 2 days that two of my children are graduating. And their graduations were delayed during COVID. Otherwise, nothing else would have stopped me. This is an absolute priority for us. The BMJ has championed the cause of tackling, addressing, gathering the evidence on racism in healthcare and medicine, and we will continue to do so. Our biggest achievement in this regard was a theme issue we published in 2020. Which covered many different aspects of the effects of race on healthcare and medicine. And we were delighted that as a result of the conversations in the BMJ and the conversations that followed, that eased the path for the creation of the Health Observatory. And since its inauguration, the Observatory has done absolutely tremendous work. It hasn't shied away from tackling any difficult issues, and it's doing exactly what's required in terms of producing evidence and data and very clear arguments about how we should move forward in addressing the inequalities that we all hope to eradicate. I will give you our commitment that the BMJ will continue its focus on racism in medicine and healthcare. We will encourage the evidence, we will publish the evidence, we will publish arguments and solutions to help reduce the impact of racism and to diminish the effects of inequalities. Because by doing so, we will improve the health outcomes, the well-being outcomes of the whole population, not just in the UK, but all around the world. From my personal experience, I moved to the UK as a young child from South Asia, from Pakistan, and I experienced racism at every turn in my personal life, in school, and then when I became a doctor, I also experienced racism during my career. So I've experienced racism, but I also know that racism isn't something that only Asian and black people experience in the UK. It's something that's experienced by all minority groups in every country. And it's something that we together need to work together to address. Now, when I was growing up, I had a distinct sense of powerlessness about how I could overcome the challenges of racism, of the racism that I was experiencing. When I embarked on my career in medicine, I did not know how to navigate that career because I was in a culture that I was very unfamiliar with. We didn't have any doctors in the family. And again, there was this all-pervasive sense of struggling against institutional racism, but also very direct racism that I came across as I grew up in South Yorkshire. When I look back now and think how powerless I felt at that time and the job that I'm doing now, and I think of all the wonderful people gathered together for this conference, there is a change. We're all at a stage in our career where we can have an impact, where we can make a difference, where we can make a change. People are looking to us. The young boy that I was 45, 50 years ago is looking to people like me now to make that change, to lead that change. And that responsibility is on all of us. We have enough power. We have enough authority. We have enough evidence. We have enough arguments. We have enough energy, commitment, and also the absolute determination to make a change. And if there's one message that I'd like to leave with you all today, it's that let's make the most of that opportunity. Let's make that change. Let's lead that change, because there are many, many people looking to us for help, for support, and looking for our lead to help change the society that they live in, that they work in, that they seek healthcare in, to make it more equal, to make it fairer, and as much as possible to eradicate racism. Now, I know that eradicating racism is probably an impossible dream, but what we can do is reduce it as much as possible, or at the very least reduce the impact that it has on the health and well-being of the populations that we care about. And when I say the populations we care about, I don't just mean the populations that we arise from as black or Asian or minority people. We care about the whole population, and the evidence does tell us that by making society fairer, more equal, by eliminating as much as possible racism, that improves outcomes for everybody. And that's something we together must work for. Thank you very much.